Greetings, and welcome to ABGs Made Simple. What are ABGs? Well, arterial blood gas studies examine the relationship between oxygenation and the components of the bicarbonate carbonic acid buffer system in order to diagnose and treat respiratory and metabolic dysfunction that can cause systemic acidosis or alkalosis, rapidly leading to patient death. Wow, what a mouthful. Did I say patient death? Yes, I did. In reality, arterial blood gas studies help clinicians to diagnose respiratory disorders and lung dysfunction that impacts oxygenation. It also helps us to determine the effectiveness of our respiratory treatments. Finally, it helps us to distinguish between respiratory and metabolic dysfunction. And it's the nurse's job to help decipher them. And that is why you're watching this video. The first thing you need to know is what's normal. Memorize these values. You're going to need them for interpretation. Let's take a closer look at these values and what it means when they're abnormal. The PaO2 and SaO2 are both measures of oxygenation. PaO2 tells us how much oxygen is available in the system. The SaO2 tells us how much of that oxygen is being used by the cells. If these levels are low, that means that your patient is hypoxemic and can lead to tissue hypoxia. A PaO2 of less than 80 or an SaO2 of less than 90% is an indication that it's time to assess and increase oxygen administration. Prolonged hypoxemia will alter the patient's acid-base status, which brings us to our next set of lab values. The remaining three labs have to be interpreted together. Start with pH. Do your results indicate acidosis, lower than 7.35, or alkalosis, higher than 7.45? If the pH drops below 6.8 or rises above 7.8, the patient will die. Next, you have to determine if the cause is respiratory or metabolic. CO2 is the respiratory indicator. It is regulated by the lungs and becomes an acid in the body. That means it lowers the pH. HCO3, bicarbonate, is the metabolic indicator. It is regulated by the kidneys and is a base in the body. That means it increases the pH. So how do we figure out what is causing our pH imbalance? This handy table is all you need to accurately interpret ABG values. First, draw your table and label your columns acidosis and alkalosis. I find it helpful to include the normal lab values here. Now label your rows, respiratory and metabolic, remembering that CO2 is the respiratory indicator and HCO3 is the metabolic indicator. Remember, CO2 is an acid and HCO3 is a base. Now you need to add your lab indicators. Let's look at acidosis first. If you are in acidosis and the cause is respiratory, the CO2, an acid, must be high. If you are in acidosis and the cause is metabolic, the HCO3, a base, must be low. Now look at the alkalosis column. If you are in alkalosis and the cause is respiratory, the CO2, an acid, must be low. If you're in alkalosis and the cause is metabolic, the HCO3, a base, must be high. Last, we will add our basic steps for interpretation. First, look at the pH and determine if you're dealing with acidosis or alkalosis. Next, correlate your abnormal labs. Finally, the value that fits your chart is responsible for the imbalance. Let's see what this looks like in action. First, determine if the pH indicates acidosis or alkalosis. In this example, our pH is 7.31, which is below the normal range of 7.35 to 7.45, which means that this is acidosis. That also means that you can ignore the entire alkalosis column. Now we need to decide, is this respiratory or metabolic? Let's look at our PaCO2, the respiratory indicator. The PaCO2 is 55 millimeters of mercury, which is above the normal range of 35 to 45. Since CO2 is an acid, we can be pretty sure that this is respiratory acidosis. But let's take a look at the HCO3 just to be sure. The HCO3 is 24, which is within the normal range. The value that fits our chart is the CO2. Therefore, this is respiratory acidosis. Let's look at that last example again, this time with compensation. Our pH is telling us that this is acidosis, so we can ignore the alkalosis column. Our PaCO2 is high, but so is our bicarbonate. How do we know that this is compensation? Because we know that the pH is acidic. We know this is acidosis. A high bicarbonate does not indicate acidosis. It indicates alkalosis. The body is compensating for the acidic state by increasing the bicarbonate concentration. We know this is respiratory acidosis because the pH tells us it is acidosis, and the lab value that fits that column is the CO2. Now you have all the tools you need to easily interpret arterial blood gas studies. Now get out there and practice. The more you apply these principles, the easier it's going to become. Good luck and happy interpreting!